Okay, so now we start the lecture session on cardiovascular receptors for neurohumoral agents. Okay. Having said this, let's begin. Am I audible? And my voice is
Yeah.
clear? The slides are clear? Okay.
Yes, it's great.
Having said this, let's begin with the lecture as such. We know that whenever we are exercising, the heart rate speeds up and there are changes in the body. Our blood pressure goes up during exercise, and these are the changes happening in due to cardiovascular system. How these changes happen? These changes happen because the ability of the cardiac muscle to depolarize and contract, and this is inbuilt property of cardiac muscle. Okay, like the heart has a in-house pacemaker, also in-house conduction system. There is presence of gap junctions. All these are inherent property of the cardiovascular system. Also, the activity of the heart and vascular tone can be altered by some external factors like a nerve supplying the heart and the vessels. We know there are autonomic nerves supplying heart and the vessels, the parasympathetic, the sympathetic, and they have got different roles in the action. Also, there can be some hormones and ions, like maybe change in level of calcium and potassium can affect. Also, physical factors, like if the person is under stress, like the person is under fear, definitely the heart rate and the vessel changes can happen. These are some external factors. Having said this, cardiovascular activities can be broadly classified into how they are controlled, and they are mainly controlled by a center in the medulla called as the medullary center. Also, autonomic nervous system has got a very big role in their control. There are some reflex activities that control the cardiovascular system, like say for instance a person is lying down, and as he stands up, what will happen to the blood? All the blood will try to settle down in the feet. But how does heart pushes the blood to the brain? Like while lying down, the heart was pushing blood to the brain. But once we stand up, heart will face has to do more work to push the blood to the brain. And how does it happen? Does it happen quickly, or does it happens? It takes time. So it happens quickly. It is a reflex action. That is the reflexes we study, and also the chemical and physical factors like emotional stress, fear, chemical factors like ions, change in ion level, change in the neurotransmitter level. So these are broadly classified who controls the cardiovascular activities. Coming to the first one, the medullary control, we will see how it is done. For the medullary control, like there is a center called as the cardiovascular center in the medulla. Everybody can cardiovascular center मौजूद है the medulla right here. And there are inputs coming to this center. The inputs can be from higher brain centers like cerebral cortex, limbic system, hypothalamus, okay, and from sensory receptors also, like proprioceptors that monitor the movement, chemoreceptors that monitor the chemicals in the blood, and baroreceptors that monitor pressure in the circulatory system. All these, like pressure, say for instance, baroreceptor monitor the pressure in the blood. When the pressure is going up, is sent to the cardiovascular center. Now this center takes the decision and then brings up the work. The center has got two outputs. One is the cardiac accelerator nerve that is done by the sympathetic, and one is the vagus nerve that is under the control of the parasympathetic. If the baroreceptor says the pressure is going up, what will this center do? This is a very clever center. What signal will it give? It will inhibit the cardiac accelerator center, because as the blood pressure is going up, and it would stimulate the vagus nerve to to slow down the heart by the parasympathetic, and will try to block the sympathetic to less stimulate the heart. Having said this, once we understand once we understand the center, how inputs are coming and how the output is brought about. This let's move further. The next one is the autonomic nervous system. As we know, autonomic nervous system, the heart and the blood vessels are innervated by the fibers of the autonomic nervous system. We know that. And sympathetic system is stimulatory for has got a stimulatory effect, and parasympathetic has inhibitory effect on the heart. The tone of the blood vessel is mainly influenced by the sympathetic. Okay, sympathetic, because most of the blood vessels are supplied by the sympathetic. There is some amount of parasympathetic supply, but that is a very rare phenomenon. Maybe only some vessels in the cheeks have been supplied by the parasympathetic. And this causes vascular tone. If vascular tone increases, that means it is vasoconstriction or vasodilation. Anybody?
Vasoconstriction.
Construction.
Vasoconstrict. Total peripheral resistance increase. TPR. Total peripheral resistance is increasing. That means vascular tone is increasing or decreasing?
Increasing.
Increasing. Very good. That means vasoconstriction is increasing. Okay, just remember this. Write it in your slides. Is that okay? And also write down vessels are mainly supplied by sympathetics. Okay. Having said this, coming to the supply of sympathetic and parasympathetic to the heart, the sympathetic fibers originate from the thoracic region, T1 to T4 segments, not much. and it supplies atria and ventricles of the heart. Both the atria and ventricles are supplied by sympathetic and also the coronary vessels. Parasympathetic starts from medulla oblongata. That is, in the medulla oblongata there is a nucleus called as nucleus ambiguous. Underline it. Okay, that is the parasympathetic supply origin, and it supplies the right vagus affects the SA node. That means right vagus supplies right atrium and left vagus supplies the left atrium, but SA node is supplied mainly by the right vagus. The left vagus nerve mainly inhibits the AV conduction in the tissues. Is there parasympathetic supply to the ventricles? The answer is no. No vagus supply to the ventricles. Okay. No vagus supply to the ventricles. That is an issue. So, having said this, coming to receptors, the cardiovascular receptors can be sympathetic and parasympathetic, or adrenergic and cholinergic. Having said this, the adrenergic receptors, alpha and beta, alpha 1, alpha 2, and beta 1, beta 2. All of the alpha and beta receptors are coming from a family of protein, that is G protein coupled receptors. And how the inotropic effect of norepinephrine and epinephrine we have studied, so we won't go repeat this. Cardiovascular receptors, where are they? This is a slide taken from autonomic nervous system. We have studied previously. There is alpha 1 and alpha 2, beta 1 and beta 2. Anybody will tell there is an alpha 3 majood or not majood? Have we studied alpha 3?
No, we haven't.
Okay. Do we have beta 3?
No.
We do. Beta 3 no, but we have alpha 3.
Can anybody check with Google and tell me?
Yes, we have the adipose, I believe.
Correct. There is no alpha 3, but there is a beta 3. And basically, it is only at the adipose tissue. It has nothing to do with any other tissue, so we do not discuss it. Adipose tissue. Okay. Adipose tissue. That's why we don't discuss beta 3 much. Correct? But there is a beta 3. The locations and the responses are written right here. Alpha 1 mainly on the blood vessels. Okay. A blood vessel. And an alpha alpha is موجود on the vessel, and if we pull these strings, what will happen? Vasoconstriction, vasodilation.
Construction.
Constriction. So the sugar of alpha 1 is vasoconstriction. Where are they موجود? On blood vessels. Simple. Alpha 2 is موجود on the neuron, especially the presynaptic neurons. Beta 1 is موجود on hearts or lung. Come on.
Heart.
Heart.
Heart. You have one heart, so beta 1 on heart. How many lungs do you have?
2
Two.
lungs.
So B2.
2 lungs. Beta 2 in the lungs. Bronchial dilation. Okay. Come please. Again, your question. Any question was there?
No, no.
Okay. So we'll move on. This was kind of a revision from autonomic nervous system. Cardiovascular receptors, receptors, nicotinic and muscarinic. Nicotinic and muscarinic. Nicotinic is mainly मौजूद cause for the skeletal muscle contraction. Muscarinic is for especially the M2 receptor is on the heart and it decreases the heart rate and force of contraction. That's what you should be knowing. Muscarinic receptor is a cholinergic receptor, so definitely the neurotransmitter is acetylcholine, and there are subclasses of muscarinic receptors M1, M3, M4, M5. The locations are given. Today we are dealing with the heart, so actually we are more interested in muscarinic receptor on heart, that is M2. What is the sugar? The sugar is about located on the cardiac tissue, increase the membrane permeability to potassium and inhibits the calcium channel. We know if calcium is not there, the main thing that will be affected is the muscle contraction. Okay, that decreases the heart contraction. That is an idea. Contraction of the heart. Okay. Having said this, acetylcholine particularly important in the stimulation of muscle tissue via the nicotinic receptors. Acetylcholine also stimulates all muscles except those of heart and blood vessels. So actually acetylcholine stimulates all muscle. We mean to say the skeletal muscles. Okay, just write all skeletal muscles in. Okay, then that will be good. Coming to the effect on heart. Sympathetic nerve release norepinephrine, which is the most important physiological regulator of cardiac muscle contractility, exerting both positive chronotropic and inotropic effects. Parasympathetic nerve release acetylcholine and exerts a negative chronotropic and inotropic effect. The cellular mechanism of noradrenaline, norepinephrine effects on cardiac contractility is mediated by the interaction of beta 1 receptors. And the cellular mechanism of acetylcholine effect on cardiac contractility is mainly mediated by M2 or the muscarinic receptors. The meaning of chronotropic means chrono means time, so mainly it is about heart rate, and iono means ion, so mainly it is about muscle contraction. Okay. In some of the situations, one of them is the major one, the other one is just very little amount effect, but still we have mentioned inotropic and chronotropic henna. It does not mean it is equally important. Okay, maybe at places chronotropic is important and inotropic is not. Having said this, like for instance what we are saying right here, the cellular mechanism of acetylcholine cardiac contractility is mediated by M2 receptors. Okay, so we know that this is acetylcholine and M2 receptors. We just now talk that vagus supplies only the atrium. So we are just concerned about the cardiac contractility and the heart rate of the atrium. Okay, so that is what one thing that you should know the meaning what it is. Okay, but how much it is really you don't have to go that deep because that will be covered in medicine, inshallah. Having said this, effects on blood vessel. What are the effects on the blood vessel? Let's see. Extrinsic control of peripheral blood is mainly mediated by sympathetic nervous system. Mainly. Parasympathetic fibers have a supply to blood vessel, but only very few, like the cranial and sacral regions of the body. Almost no effect except to dilate vessels in certain restricted areas like blush areas of face. So vessels in the face are affected by parasympathetic, and also cranial and sacral regions of the body, and just they dilate the vessel. So parasympathetic, if somebody asks what is the major supply of the blood vessel, is it sympathetic or parasympathetic? So it is sympathetic. Parasympathetic is at very less places. Having said this, the heart rate and blood pressure, these are the two parameters of cardiovascular system. These are the two things body wants to maintain constant in homeostasis. One is the heart rate and other is the blood pressure. And this is exactly, as a doctor, we also want our patient heart rate and blood pressure not to be too high, not to be too low. We want to maintain it as normal as possible. Okay. So will anybody tell me what is the normal heart rate medically for our adult person? Normal heart rate.
60 to 100.
70 to
60 to
90.
100. 60 to 100 is the international acceptable answer. Okay, 60 to 100 beats per minute. Good, very good. What is the next question? What if it is less than 60? If it is less than 60, what do we call it? If it is more than 100, what do we call it?
One is tachycardia and the other is, I think, brachycardia. I don't know.
Bradycardia. One is bradycardia and one is tachycardia. Which one of them has a letter D in it? Brady or tachy? Letter D मौजूद in which one of these ism? Brady or tachy? Tachycardia, bradycardia. Brady. So D for decrease. So this is Brady. B R. I am really sorry for my poor writing. Brady. Cardia. 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 Okay, somebody will say cardia is there and another D. So yes, I am talking about mainly cardia is same in Brady and Techie. I'm not talking about the common stuff. I'm talking about, does Brady has a D or a Techie has a D? Techie. Tachy. Which one has a D? D is मौजूद in Brady.
Brady.
Okay, right here. So Brady is D for decrease. So decreased heart rate is bradycardia. So less than 60 is bradycardia. More than 100 is tachycardia. Clear? Let's move further. You will study. You have studied that cardiac output is same as. Can anybody tell me the formula for cardiac output? Cardiac output. How do we calculate cardiac output?
Well, cardiac output equals the cardiac input.
stroke volume and heart rate.
Cardiac output is nothing but you multiply two of the stuff, stroke volume and heart rate. And did you know that stroke volume depends upon three further things? The preload, the afterload, the contractility. Have you taken this stuff? Have you explained it to you in
Yes,
previous
yes.
lectures? Okay. And heart rate depends upon the hormones being released and the neurotransmitters being released, neurohormonal regulation. Okay. So anything changes can affect stroke volume and can affect the cardiac output. Will anybody tell me about what is a preload?
The load on the muscle before contraction in the relaxed state.
Yes, good. The load on the cardiac muscle before contraction. Nuffer met with an accident and he has lost 1,000 milli or 1 liter of blood. Okay, so then the circulation, there is more blood or less blood?
Less blood.
Less blood. So the blood going to the heart and the load on the heart is more or less?
Less.
Less. So if preload is less, stroke volume will be less. If stroke volume is less, cardiac output will be
Less.
Less.
less. Cardiac output is less, blood pressure will be. Pressure in the blood vessels will be. Cardiac output is less. I hope so. Everybody knows what a cardiac output is.
Yes.
So any other situation in which preload is less? Situation which preload is less. Anybody?
Doctor, your voice is lagging. Can you repeat the question, please?
Any other situation in which preload is less? Less of preload?
Less venous return.
Less of venous return. Anything causing less of venous return. So, well, so this is a flow diagram that we know the cardiac output, stroke volume, heart rate, and how this is all related to blood pressure. Okay. And this whole of the stuff is being managed because we are managing the cardiac and the vascular system. That is what you should be knowing. So let us summarize. This is our heart. And this is our vessels right here. This is the heart. And this is the vessels. First, we will talk about heart. So heart is being directly controlled by the medullary system, cardiovascular center in the medulla. Okay. And how it is being controlled by sympathetic and parasympathetic nerves. Sympathetic, what effect does it has? Sympathetic through beta 1 receptors will stimulate the heart. The heart rate will go up and the force of contraction will go up. Okay. Sympathetic, what effect does it have on vessels? The vessels, blood vessels. It increases the vessel tone and increases the blood pressure. Okay. Increases the vessel tone, it causes vasoconstriction. Are there blood vessels where the sympathetic can cause vasodilation,
Yes.
can decrease the vascular tone? Which vessel it is? That
I think as you said, yeah, as you said,
under exercising condition, the vessel should be dilated. Which one? To bring more blood.
in the
Vessels of in the muscles. So if alpha 1 receptor is causing vasoconstriction, there should be another receptor that is causing vasodilation. Which is that?
B1.
Anybody?
I think it's alpha 2.
B1 is on. B1 is on. Alpha 2 is on neurons, not on vessels.
Beta 1 on the heart.
Beta, no, not on the heart. We are talking on the vessels. Beta 2 is on the vessels, will cause dilation. Okay. B1 is on heart. B1 is on heart, guys. Don't get confused. You have one heart, B1. You have two lungs, B2. But good doctors, 99 percentile scorers will also know that this B2 that is mawjood in the lungs is also mawjood on the some vessels that dilate under stress, under exercise, under sympathetic condition. Is that okay? Having said this, what about the parasympathetic? Okay, maybe this is a higher grade info that you get confused. Let's believe that B1 is on heart, on the vessels, and they constrict. That's it. Coming to the parasympathetic. What does parasympathetic, through which receptor does it act on heart? Parasympathetic, anybody?
M2.
M2 receptors. Okay, parasympathetic muscarinic receptor. It decreases the heart rate, it decreases the force of contraction. What is on the vessels? What effect does a parasympathetic has on vessels? No major
Causing
effect.
some
Dilation.
Just dilation, and with that also in some very specific areas like areas of face. Okay, it causes vasodilation. That's it. So this is what summarizes what controls the cardiac and the vessel system. Okay, and this brings to the end of the lecture. And as we started up with what controls the cardiovascular system, we have talked about the medullary control and the autonomic control. Okay, today we will further talk about the reflexes in other class. Is that okay?
Inshallah.
Okay. When do we have our next class?